Thank you, everybody. So I think that we're now going to begin this important session today. My name is Eric Carlin, and I work as part of the alcohol team at the WHO Regional Office for Europe. And my task today is really just to kind of guide us through the programme, trying to keep, as far as possible, people to keep to time and ensuring that we have as much opportunity as we possibly can for questions and discussion about this important report that's being launched today. So if you go to the next slide, please, Haram. So this is just the guidance in terms of how we run the session. So if you wish to, if you can mute your microphones when you're not speaking, if you can raise your hand if you wish to speak, and I'll try to make sure that we pick up everyone as far as possible. Do not hesitate to ask questions, write comments or other remarks using the chat. And please note that the session will be recorded. We also have interpretation for this meeting, which will be in Spanish and in Russian. And if you look at the bottom of your screen towards the right-hand side, you can see the interpretation channels, and just pick the channel that you wish to use. Okay, so I think that's all clear. I think we're all pretty well versed in these meetings nowadays. So without further ado, I'd like to pass over for the welcome and opening remarks by Carina Ferreira Borges, the Senior Advisor on Non-Communicable Diseases and the Programme Manager of the Alcohol and Illicit Drugs and Health in Prisons team at the WHO Regional Office for Europe. Over to you, Carina.
Thank you very much, Eric, and good afternoon, good evening, good day to all of you that are joining us online. Thank you very much. It's a great pleasure to be with you, and we are delighted that you are here for the launch of our new report, No Place for Cheap Alcohol, the Potential Value of Minimum Pricing for Protecting Lives. So why is it that this report is so important? First of all, I would like to start by saying that in our region, this is very relevant because we have the highest levels of alcohol consumption at global level, and also we have the highest alcohol attributable fractions of mortality. This means that a lot of people die, meaning that alcohol is a key risk factor for public health relevance and also for concern. So we also know that we are in a region of special relevance for these discussions because we have been the first responder to this harm. We are in 1992, we issued the first action plan, and we've been issuing a lot of documents and strategies to reduce the alcohol consumption. So we're very proud to be the ones leading and making sure that we respond as we identify the main challenges, and we're able to support the member states in also addressing those challenges that we see rising. So together with the colleagues from the Pan-American Health Organization, so from PAHO, it's a WHO office in the Americas, we have been working on taxation. We have developed tools called alcohol policy scoring tools that show clearly that in both of the two regions, pricing policy measures that policymakers can use to address harms. And yet, as I mentioned, they're the least implemented and the most underutilized. So this report provides us a first ever review of global mapping, and we will see how minimum pricing policies on alcohol are lacking in many countries. We also will see the summary of the most recent evidence on this area and also on the impact. The report discusses the minimum pricing as a specific way of connecting also with other pricing policies and alcohol taxation. So this is about comprehensive policies that can be put in place. And again, here I would like to highlight the special initiative also that our regional director has put in place, strongly supported by the NCD Council, that also has a signature initiative on alcohol taxation, looking at the potential of taxation, but also of other pricing policies to be able to impact in consumption and also on, evidently, on harm. So one of the key takeaways of our report is that minimum pricing policies cannot be implemented in a vacuum. They work best when they are used in combination with effective evidence-based pricing policies as taxation. These policies can then work together to reduce harm from alcohol and also to increase government revenue. So I hope that everyone will take from this launch enough knowledge, and also from reading the report, the potential that pricing policies has to reduce harm from alcohol and to improve health in our region and also at global level. I want to take also a moment to thank everyone who was involved in the development, in the writing, in the review of this report, to whom some of you are here and you will be hearing in our event. We also received quite a lot of support and advice from many experts all over the world, and also from our country representatives through the process of drafting the report, and we are very grateful to all of them. And finally, this report would not have been possible without the funding that WHO receives from governments, and in particular the funding received from Netherlands and Norway. So we are very grateful to have been able to work on this report. And I'm very happy that we'll be hearing also a representative from Netherlands next. And please accept our heartfelt thanks for your support in this important work. It would not have been possible, as I mentioned before. And last thank goes to all of you, all the speakers and all the people, audience that are here and who have joined us today to learn about these crucial issues. We have about 108 participants joined at this point. We really appreciate your interest, and I wish you all a very productive meeting. Thank you very much, Eric. I give you the floor. Thank you.
Thank you very much, Karina. And also in introducing Jerome, I wanted to say on behalf of my colleagues and myself, it's great to see you twice in 1 week. We met last week at the European Alcohol Policy Conference, which is a great way of persuading you to come and say a few words at this meeting today. So if I can pass over to Jerome, who's the Policy Officer in the Ministry of Health, Welfare and Sport at the Government of the Netherlands, please. Thank you.
Thank you, Eric, and good afternoon all. Yeah, what you just said, Eric, that proves that it's important to have real life meetings again. So otherwise, maybe I wouldn't have been here today. So thank you for the opportunity to say a few words at the launch of the report on the minimum pricing of alcohol. And yeah, the Ministry of Health, Welfare and Sport in the Netherlands has supported this study because we believe it's a very relevant report in view of the objectives to reduce the harmful use of alcohol. As many of you will be aware, the World Health Assembly has recently adopted the action plan to reduce the harmful use of alcohol as a public health priority for the period 2022 till 2030. And in this action plan, the member states are called upon, among many other things, of course, to implement strategies and interventions which address the affordability of alcohol by appropriate taxation and pricing policies. And this report will therefore be, in my view, a very useful source for the governments of the member states that want to follow up on the proposed actions for member states in the action plan. It's thanks to the WHO and other researchers, of course, we already know that raising the price of alcohol is a cost-effective intervention and one of the 3 best buys to reduce the harmful use of alcohol. But I think an important added value of this report that it focuses on a lesser known side of pricing policies, namely minimum pricing policies. And I was lucky enough to receive the report yesterday. And in my view, it gives a great overview of what minimum pricing policies entail and the evidence on their impact. I particularly liked the chapter on common objections to minimum pricing policies because it's likely that we as policy officers will have to deal with those objections when we are considering implementing those minimum pricing policies. So I'm therefore glad that the report not only mentions the common objections, but also provides the counter arguments that can be used. I'm convinced that this report could contribute to the effective alcohol policies, and I would therefore recommend it not only to the governments of member states, which I mentioned before, but to everyone who is involved with alcohol policies. On behalf of the Ministry of Health, Welfare and Sports in the Netherlands, I would like to thank the WHO for their excellent work and congratulate them with the report. Now, I don't want to waste more of your time because I think it's much more interesting to hear about the main findings of the report, and I think the follow-up discussion will be very interesting as well. So that's all for my side, and thank you again.
Thank you very much, Jerome, and indeed we're really looking forward to the discussion. So hopefully we will have some time for that towards the latter part of the meeting. I just want to explain how the meeting will now be structured. So we'll first of all have an introduction to the report and a description of the content of the report. And then we'll have 3 expert commentaries on the report, locating it within its context and saying why it's important. I think it's really important to recognise that although this is a WHO European region report, it has taken a global taken a global view. So we're really delighted that we have our colleagues from PAHO and also our colleague from the Less Alcohol Unit at WHO headquarters, who will be summarising our discussion. I wish you luck with that one when we come to it. But obviously locating that the issue of affordability and having effective policies to reduce affordability is not just a European issue, it's a global issue. So without further ado then, I'm going to pass on to Colin Angus, who has been working on this report for several years, who is a senior research fellow in the Sheffield Alcohol Research Group at Sheffield University in the United Kingdom. So over to you, Colin. Thank you.
Okay, can I just check you can see those slides?
Yeah, all works.
Super. Right. Okay. Thank you very much, Eric. Thanks, Jeroen, for that nice introduction. I'm going to try and give like a quick overview of some of the headlines in the report. It's really a deep dive into minimum pricing with a kind of focus on being practical, providing practical information and evidence and guidance for policymakers who might be interested in learning more about minimum pricing and thinking about whether it's for them. So we're just going to sort of scratch the surface of some of that, but there's lots more detail in the report. So I'd obviously encourage you all to go and read it. Okay, so a little bit of hopefully not news to anyone background. So, you know, as I'm sure we all know, alcohol kills almost 1 million people in the WHO region every year, places a huge burden on healthcare services, reduces economic productivity, and has many, many other negative impacts on society. And we know that price is one of the most effective tools for reducing alcohol consumption. It's one of the best buys with very good reason. But alcohol pricing policies are very much like opinions, I think. So everyone has one, whether we like it or not. And it's true that every country in the WHO Europe region has some form of alcohol taxation. So we all have pricing policies for alcohol. But as the last few years on social media have certainly taught me, many of the opinions that we have are bad. And in the same way, many of the alcohol pricing policies that we have are bad or certainly not optimized from the perspective of public health. And so our role here is to try and provide information to improve that situation. So a couple of years ago, WHO Europe, excuse me, published a report which highlighted that pricing policies were very underused and often poorly designed from the perspective of public health across the European region. It's all right, look like that. It's good, you should go and read it. But that report focused mainly on tax policies. And increasingly kind of political dialogue since then has sort of has increased around the subject of minimum pricing, and also the evidence base has grown even within those last few short years. And so, you know, we've got this new focus on minimum pricing as potentially another approach to pricing policies, which we could use to help reduce the burden of harm. So that's where this report came from. And just a kind of quick overview of what's in the report. So there's a description of, you know, what is minimum pricing. There's an overview of who has minimum pricing. And this was even as someone who has spent many years involved in alcohol research, this was both difficult and surprising to learn who secretly has minimum pricing policies that no one knew about. We review the evidence for whether it works or not. We look at, as Jeroen said, common objections to minimum price and kind of really kick the tires of those arguments to see whether they stand up to scrutiny. There's a chapter all about legal issues, which I'm not going to get into in this presentation because some of them are quite complicated, but we've tried to make it as accessible as possible. But they cover issues around the legality of minimum pricing under different international legal framework. So under the European Union, under the World Trade Organization, under the Eurasian Economic Union, and the implications for members of those various organizations about the legality of minimum unit price, pricing. There's a section about what happens after it's introduced. So discussing things like enforcement, evaluation, and the importance of these things, but with a focus on providing practical guidance. And then there's a section discussing how to choose the right pricing policy. So minimum pricing is just one of the options when it comes to pricing policies, and the relative merits or effectiveness of different approaches to pricing policy will depend on the individual context in any given country. And so we're sort of discussing where things might work better, or other, which approach might be best in different circumstances, or where there might be some forms of kind of complementary policies you can enact that would enhance the effectiveness of different pricing policies. So I'm just going to give a summary of the first few of those bullet points. So what is minimum pricing? Well, in the simplest possible terms, a minimum price is just a floor price below which you cannot sell alcohol. And there's kind of two main forms, sort of flavors of minimum price. One of them, which we just call minimum price, is where this floor price applies to a fixed volume of product. Okay, so that says you can't sell a bottle of wine or a bottle of vodka below a certain threshold. And then there's a slightly more sort of a separate formulation of minimum pricing, which we call minimum unit price. And so that's where this floor is based on a fixed volume of alcohol. So that says you can't sell a standard drink or a gram of ethanol for below a fixed threshold. And in general, the minimum unit price is more effective because it's more specifically targeting stronger products, right? So the minimum price for a stronger bottle of wine might be the same as for a less strong bottle of wine, but the minimum unit price would be higher, or under a minimum unit pricing system, it'd be higher. And so because it sets a lower threshold for the cost of alcohol, minimum pricing very specifically targets cheaper, high-strength alcohol, which is the product most commonly consumed by heavier drinkers, who are, as we all know, the people who are suffering the most harm from alcohol. So this is kind of the key appeal of minimum pricing, is that it very specifically targets the things that are most commonly drunk by the heavier drinkers. Now, we've talked about taxation being kind of a major pricing policy. There's reports and hundreds of thousands of research papers written about tax. So why is minimum price not just tax? What's different? Well, as I say, because it only affects cheap, high-strength alcohol, it's different to tax, which affects the price of all alcoholic products to some extent. And there's some discussion in the report about how different forms of taxation kind of have different impacts across the alcohol pricing spectrum compared to minimum pricing. But the key difference is this: minimum pricing is only affecting the cheap, high-strength products, whereas tax affects the price of everything to some extent. But another important difference that we need to consider is the fact that with tax, when you increase taxes, any additional revenue goes straight back to government, whereas with minimum pricing, much of the additional revenue goes to producers and retailers and not the government. And so with this in mind, it's important not to view minimum pricing as tax as alternatives. It's not an either-or decision, right? They're complementary policies that can be combined to reduce harm while retaining revenue for government. So there is a kind of a clever middle ground where you have a bit of both, and everybody wins. Okay, so who has it, right? I said this was interesting and no small feat to compile this information. Well, here's a a big old map of the world, right? The red countries are places which have some form of minimum pricing. And minimum pricing has kind of evolved in several different waves, really. So the oldest minimum prices are in the Canadian provinces. And then about 20 years ago or so, Russia and some of the former Soviet states introduced forms of minimum pricing. And then more recently, there's been a kind of a newer wave, right, with countries like Scotland, Wales, the Republic of Ireland, and Australia's Northern Territory introducing minimum unit prices. But there's also been some interesting changes over the more recent period in Eastern Europe as well. So there's some interesting things going on, and we've got a lot more detail about you know, the differences and who did what when in the report for people who are geekily interested in that sort of thing like me. Okay, and then the million-dollar question, really, does it work? Well, we've got lots of different ways of looking at answering that question. So the first way is we can just look at the theory. Okay, you know, if you and it's really obvious in the theory. There's overwhelming evidence that says when you reduce affordability by increasing price, that reduces alcohol consumption and that reduces harm. So the theory behind minimum pricing is pretty bulletproof. But we're still talking about theory there, but we can go better than that. There's a whole raft of modeling studies which kind of draw together the evidence in a much more specific way. And they also support that minimum pricing reduces harms. And another sort of key finding that those studies show very consistently is that minimum pricing also narrows health inequalities, because it's particularly targeting the products that are drunk by heavier drinkers, particularly those from lower socioeconomic groups, who are the ones suffering by far the highest rates of harm. But you know, as the evidence has emerged more recently, we have even stronger evidence now from direct evaluations, right, where countries have either introduced minimum prices or raised minimum prices. We've got really compelling evidence that shows that that's led to falls in alcohol consumption. And there's good reasons from that evidence to believe that those falls have been bigger in heavier drinkers, which is exactly what we would expect and want, which is great. And then there's the data from Canada shows that alongside these falls in alcohol consumption, there have also been concurrent falls in alcohol-related harm, which again, that's what we'd like to see, and that's good news. As many of you will know, Scotland introduced minimum unit pricing in 2018, and since then have had what must be one of the most comprehensive evaluation packages of any public health policy that I'm aware of. And many of the aspects of that evaluation have looked for potential unintended negative consequences. Did heavier drinkers switch to illicit drugs, for example? Was there suddenly a big increase in cross-border traffic, people driving over to England where minimum pricing wasn't in place? And a really clear picture that's emerged from these studies is that although there have been very isolated incidents of some of these negative effects being observed, and you know, we looked really hard for them, but they've not come to pass to any significant extent, which is really good news, right? It's great that we looked for these things, and it's even better that we didn't really find them. So that's reassuring, that's great. But it's important to note that the evaluation of the health impacts from Scotland is still to come. Okay, and now I'm just going to sort of whiz you through some of the common objections and a quick summary of kind of the responses to those from the perspective of the evidence. So it's often said by people that minimum pricing penalizes moderate drinkers. Okay, well, that's just not true. It doesn't stand up to, you know, even the most basic scrutiny, because minimum pricing specifically targets only the cheap, higher strength products, and it has very little or no impact on the prices of the more expensive alcohol that's consumed by most moderate drinkers. And so as a result, it's very effectively targeted at the products drunk by heavier drinkers, and just doesn't penalize moderate drinkers because they're not drinking this same cheap, strong alcohol. So it's very effectively targeted at exactly the people you'd want it to be. Another common objection is an argument that minimum pricing is a tax on the poor. Okay, and that's also not true, because even moderate drinkers on lower incomes buy actually relatively little of the very cheap alcohol that's being targeted by minimum pricing policies. However, as I said, the more deprived, heavier drinkers, they are more affected, than less deprived, heavier drinkers. But those are exactly the people suffering the most harm. And so they're exactly the people, excuse me, whose drinking we want to target if our aim is to reduce harm and health inequalities, which it is. So the policy is really effectively targeted, and it's not sort of hammering the pockets of poor moderate drinkers. That's just not what the evidence says. Okay, so another objection, this is an argument that minimum pricing will damage the economy. Okay, so it will, by increasing the price of alcohol, shopkeepers and alcohol producers will go out of business, is the argument that gets made, or, you know, it will damage the economy more broadly. That's also not true. It is the case that minimum pricing reduces the total volume of alcohol sold, right? That's the point. But this is offset by an increase in the average prices that people pay. So people are buying less alcohol, but paying more for it, which means that overall, there's little or no negative impact on the alcohol sector. And then more broadly, reductions in alcohol harm and associated gains in economic productivity will accrue across all sectors of the economy. So overall, so the sort of the alcohol production and retail sector of the economy isn't negatively impacted. However, the wider economy is positively impacted because reducing harm is good for the economy because there's more people in work and so on. Okay, another argument, right? Minimum pricing will cost the government money. Well, that's not really true. It is true that it's likely to reduce government revenue from alcohol taxes. But this is, you know, almost certain to be far exceeded by reductions in costs associated with the harms of alcohol. So things like lower healthcare costs, reduced policing costs, and as I said, increased economic productivity. So overall, it's overwhelmingly likely that introducing minimum pricing is you know, improves the coffers of the government. Even if you lose money from alcohol taxation, you more than gain it back elsewhere. Okay, another argument, minimum pricing will lead to an increase in unrecorded alcohol. So either illicit production or cross-border trade or things like that. And, you know, it's important to say there is potential for increases in illicit consumption or production, but the evidence that we've got so far doesn't suggest that this has been widespread where minimum pricing has been introduced. That's not to say that we shouldn't think about it, and it might be appropriate to introduce some complementary policies alongside minimum pricing to address this unrecorded alcohol consumption. And this certainly, you know, this can be done. Russia's done some amazing things to reduce unrecorded alcohol, and doing that is also a win-win, right? Because you reduce the unrecorded alcohol consumption, but you also increase government revenue because suddenly you have to pay tax on all this previously unrecorded alcohol. Okay. And then, you know, another argument that often gets made, minimum pricing will increase alcohol industry revenue. The alcohol industry will then reinvest that money in marketing or something else that will increase alcohol consumption and increase harm. And, you know, there are some like an element of truth behind those concerns. It is likely that introducing minimum pricing on its own will increase revenue to alcohol producers and retailers. And it's important, though, to offset that, you know, any negative impacts that might arise from whatever the industry do with that additional revenue against the benefits, the health benefits that we'd get. But it's also important to say that, again, complementary use of policies, so in this case, taxation perhaps, could be used to recoup some of this revenue if that's, you know, that's politically desired. So, you know, there's a nice potential synergy between minimum pricing and taxation, which can be used to mitigate this potential concern if that's, you know, that's an important consideration in your country or jurisdiction. And then lastly, I just want to pick up on this really important point, which is a huge part of the public discourse, I find, right? This idea that dependent drinkers won't change their drinking. And there's a few aspects to this. And the first is to recognize that the majority of heavy drinkers are not dependent drinkers. Often the public have in mind there's only two kinds of drinkers, right? There's the nice moderate drinkers, and then there's the dependent drinkers, and there's nothing in between. And that's completely a mischaracterization of the situation, okay? There's a huge number of very heavy drinkers who are not dependent on alcohol. And there is really good evidence that those people will reduce their consumption when prices rise, and they're suffering huge amounts of harm. So there are people who are price sensitive, who are going to respond to minimum unit pricing or increases in taxation. So it's not, it's not right to just go, oh, well, dependent drinkers won't change, so we shouldn't bother doing anything. But we also need to recognize that the dependent drinkers themselves are a very diverse, vulnerable, and complex group. And although we've got some evidence to suggest that many of the fears for this group have been misplaced, there is some evidence of some unintended negative impacts. Okay, but we can do something about that, right? So it's important, if you're concerned about these vulnerable groups, that when considering introducing a minimum pricing policy or even increasing tax, we consider additional support for this group. So, for example, additional funding for treatment services or things like that. And I guess it's also worth saying that even though something like minimum pricing might not have a huge impact on the drinking of dependent drinkers now, it certainly will arrest the kind of sort of cut off the pipeline for future dependent drinkers, right? It's much harder to become a dependent drinker if the availability of really, really cheap, strong alcohol has been curtailed by a minimum pricing policy. So, it still has benefits for future potential dependent drinkers. Okay, and just to sum up, right, minimum pricing represents an effective approach to reduce alcohol consumption and harm. Okay, we've got clear evidence to show that. And the really key feature of minimum pricing and its key appeal is the way in which it targets cheap, high-strength products and therefore heavier drinkers in a way that is much harder to achieve through tax. But it's not some silver bullet. Okay, it's not the answer to all of the world's ills. It's another effective tool in the policymaker's armory to address alcohol harm. And as I've said a few times, it has the potential to work best in combination with other policies, both alongside taxation reform, but also wider policies to address some of the other issues, things like funding for treatment services or policies to address unrecorded alcohol. Okay, and that's me. Thank you.
Thank you very much, Colin. And I think that I think everyone will join me in really appreciating how you cover such wide territory in such a short space of time, and also how you distill what can be really complicated and difficult messages into something that's really kind of comprehensible for us. So greatly appreciative of that. Can I just encourage people, if they have questions, to put them in the chat, and we'll look at picking up afterwards. But in the meantime, I think we're just going to continue with the responses to the report. So the next presenter is Franco Sassi, who's the Professor of International Health Policy and Economics at Imperial College London in the UK, and also a member of WHO European Region's NCD Advisory Council. So Franco, over to you. Thank you.
Thank you very much, Eric, and good afternoon, everyone, or good morning if you are in a different time zone. I want to congratulate Colin and WHO first of all for a really valuable report. It's a really excellent piece of work that will really help governments throughout the region and possibly beyond the region as well. So I wear at least two hats today. I mean, one is NCD councillor, as Eric has just said, but also, of course, I'm a professor of economics at Imperial College, and I want to remind the audience in this brief presentation of what the economic rationale is for using minimum prices and alcohol taxes as two ways of addressing alcohol prices and raising them to a level that would reduce alcohol harm and the harmful use of alcohol, basically. So let me start by focusing on the market for alcohol beverages, which is really what we are talking about today. And there is a book that probably most people in the audience know, which is entitled No Ordinary Commodity, which couldn't have been given a better title. Actually, it's a book on alcohol policy that really emphasizes the peculiarity of alcohol beverages as a product that is being sold and consumed on a market which is really very special. From an economic point of view, clearly the alcohol market is a market that is rife with failures. So it's a market that is far from efficient and far from allowing people, consumers in particular, to maximize their utility in consuming alcohol beverages or the product that is exchanged on that market. The first reason, of course, we all know is externalities. I mean, there are major external effects of alcohol consumption, these being the effects that are produced on people and subjects that are different from drinkers themselves. So these are traffic accidents, for instance, the victims of domestic violence, all those harms that we know perfectly well to be associated with alcohol consumption and which make alcohol the public health area with the greatest, as I say, externalities of all the areas that we tend to deal with in public health. So that itself is a sufficient justification for government intervention. But there is another major dimension, which is what today we call internalities, which is essentially effects on our future self. So the harms that we are causing to ourselves by drinking alcohol or drinking alcohol to excess in the future. And of course, it may be perfectly justified for people to accept a risk and still engage in a given behavior that will lead to a potential harm in the future. But it's less justified if there are failures that lead, to underestimating the risks involved in that particular behavior. And we have again a host of failures in that market, in the alcohol market, that lead, to major internalities, and these are information failures, failures in perceiving the size of the risks that are involved, behavioral failures that have to do, for instance, with the way we think about future outcomes as opposed to our present outcomes, and also the manipulation and deception that we're all subject to, from alcohol manufacturers and suppliers in general. So all of this makes a very strong case for government intervention to modify market condition, and particularly, the market condition that governments are best placed to modify is the prices of the products that are exchanged in a particular market. So there is a very strong rationale for governments to try and change the prices at which alcoholic beverages are sold. And there are at least two ways of doing this. One is price regulation. And clearly Colin's report focuses on minimum pricing policies, but there are many different types of price regulation that can be used by governments and are used by governments throughout the world. And these include, in addition to minimum prices, also the regulation of price promotions or bans of price promotions, which have been enacted by many countries, of course. Minimum prices are probably the ideal, the policy of choice in this area, but there are countries that not willing or not able to implement a policy like this, and may still find it useful to use regulation of price promotions as a second best option in price regulation. And then, of course, we have taxes. Taxes, as Colin has explained in his presentation, have been the focus of government policy and much of the public health debate about pricing policies on alcohol for many years. Taxes have been applied for millennia to alcohol products. The problem is that they've not been applied for improving people's health. They've been mainly applied to raise revenues and to address externalities. Now we really need to refocus existing taxes and introduce new taxes or raise existing taxes in a way that is conducive to improving people's health and addressing those internalities that I was talking about in the previous slide. So when we think about price regulation and fiscal policies, if we are serious about tackling harmful alcohol use, we really need both. And we need both because they're complementary. We need both because they are synergistic. And the trade-offs that we have in using the two policies together are really minimal. Colin has emphasized that there is a potential risk of minimum pricing policies, for instance, affecting revenues from alcohol taxes. The Scottish government was concerned before introducing the policy that these would have reduced revenues from alcohol duties. In fact, what has happened in Scotland is that alcohol duties have increased, not decreased. So there is a theoretical risk, a theoretical trade-off, but in fact, I mean, the evidence is showing that this is not always and necessarily the case. So trade-offs are not really something to worry about. We really need both because of their synergies, rather. So what we can achieve by using alcohol taxes is essentially a change in the behavior of consumers, which is largely the effect of increases in the prices of the products that are sold on the market, but also the effect of the signaling of a risk that is associated with drinking alcohol products. And as I mentioned before, the lack of a clear perception of those risks makes it extremely important for governments to emphasize those risks in every possible way, including by taxing and raising existing taxes on alcohol products. But of course, governments may also want to provide incentives for businesses to change their behavior. It's not just consumers, it's also businesses. And the UK government, for instance, has recently announced a reform of alcohol duties, which is partly in the direction of incentivizing the reformulation or the reduction in the alcohol content of beverages where this is possible. So there are ways in which pricing policies, particularly taxes, can incentivize behavior change by businesses as well. Of course, we can address externalities by using taxes, and taxes generate revenues. Unlike price regulation policies, as Colin has emphasized, taxes do generate revenues, and these revenues can, in some instances, be directed to public health programs or to supporting public health action, which should be an additional public health benefit of those revenues, or of those policies, of course. On the other hand, price regulation policies are important because they allow us to target a very specific segment of the market, of the alcohol market, which is linked to patterns of consumption that are especially harmful and dangerous. So it is some of the most vulnerable alcohol consumers that benefit the most from policies like minimum pricing policies or price regulation more generally. At the same time, there is evidence that price regulation can, as well as taxes, do change the behavior of consumers and also address externalities, of course. They don't generate revenues, but as I say, that may or may not be necessarily an issue when you have a strong taxation system working alongside minimum pricing. So the question is really, where do we want alcohol prices to be ideally? And of course, again, we are facing a very complex market here, a market in which we, from a public health perspective, we are trying to prevent people from drinking alcohol, or we're trying to get them to drink less of it. But at the same time, people demand alcohol beverages rather than alcohol per se, or at least in many instances they do. There are probably differences between consumers of cheap alcohol and consumers of more expensive alcohol, where consumers of cheap alcohol probably are after alcohol per se, whereas consumers of more expensive alcohol are looking for beverages rather than alcohol per se. I mean, this is a simplification, of course, but that I think provides an illustration of how complex it is to identify what prices should be changed and how we should really try to change prices in the market in order to achieve the greatest public health benefits. So in conclusion, I think the two principles that we need to adopt when we try to change prices in the alcohol market is that prices should increase to a sufficiently large extent to create incentives for people to change their behaviors and for businesses to change their behaviors. And the price increases must be designed in ways that will limit opportunities for unwarranted substitutions. So when the NCD Council has been thinking about a signature initiative in the area of alcohol or in trying to reduce the public health, the detrimental public health consequences of alcohol consumption, we have come up with a proposal that involves a minimum tax share in alcohol beverage prices, but also a series of price policies designed to equalize or promote an equalization of market prices per unit of alcohol across different beverages, because this is ideally where we want to be in the alcohol market, a market in which every unit of alcohol costs the same price to consumers, regardless of what beverage it is provided by and what brand ideally and what product. The best way to achieve this is not clearly solely through taxes. We really need carefully designed taxes and also minimum pricing policies, because, as I say, the synergy between the two gives us the best opportunities to address all the aspects of alcohol harm that derive from alcohol market dynamics. And let me just, before I conclude, put a plug in for a new book that WHO and Imperial College have been producing over the past few years, which is finally being launched on Friday this week. In person in London and through a WHO webinar, which is addressing to a very large extent the design of alcohol taxes. So it would be a very useful complement to the fantastic work that Colin has been doing on minimum pricing. Thank you.
Thank you very much indeed, Franco. And I realize that you're traveling today as well, so we appreciate wherever you are, where you're doing that from. It would not be an event without somebody plugging a book as well. So greatly appreciate you doing that, and we will certainly be looking out for that and learning from what's in the new book. I'm going to pass on, because one of the things that's really important is that we have impact in countries. The whole point in WHO commissioning this work is so that we have impact in our countries. So I'm going to pass on to Professor Jürgen Rehm, who I'm sure needs very little introduction, and there's too much in these lines in the programme for me to read it all out. So if I say that Jürgen is from the Centre for Addiction and Mental Health in Toronto, Canada, and also a member of the WHO Europe NCD Advisory Council, and passing on to you, Jürgen. Thank you.
Thanks a lot, Eric, and thanks a lot for inviting me. My task is to be a little bit more concrete what can be done in countries and what can be done together with WHO Euro of all those principles which we've heard. So it is about building capacity for country impact, what can and needs to be done to reduce alcohol affordability in our region. So basically, we are facing a situation in Europe that alcohol policies are underutilized. We've heard about that. And if we take one of those indicators, which Franco has already mentioned, the tax share. The tax share is how many percent a consumer pays to the government if he or she buys an alcoholic beverage. And this tax share in Europe is very, very low. It is less than 1/5 of tobacco products, meaning that overall, for any alcoholic beverage which is bought in Europe, on average, less than 15% will go to the government, will go as taxes, which means that there's a huge potential which can be used to regulate better the alcohol market. We do have in Europe several alcoholic beverages in countries like wine in 22 countries in the WHO European region, which have no tax at all. And because there are no taxes, and because there is inflation and the taxes are stagnant on a low level, alcohol has become more and more affordable in the European region. So this is the principal situation which we want to change, and we want to change that for two reasons, as Franco has already alluded to. First of all, for public health reasons. We have close to 1 million deaths and countless hospitalizations and other health problems in the regions due to alcohol. And secondly, to pay for the externalities. The costs associated with alcohol by far outweigh any of the gains alcohol is bringing to our economies. Even if we triple our taxes, or if we come up with a tax share which is closer to the tax share of tobacco, we could not pay for all of the harms caused by alcohol. So alcohol for a government overall is a negative balance. And the externalities are never covered by taxation. And so that is one more reason why to regulate the alcohol market better. So how do we do that? Well, several countries in the past few years or months even have asked WHO for assistance in reducing alcohol attributable harm and in increasing revenue. And what has happened there, and I'm just speaking about in practical terms, and I've been part of the group which has been interacting with the countries on behalf of WHO Euro in advising what could be done in a country. And basically what happens is meeting with stakeholders, minimally with representatives of the ministries of finance and health. It doesn't help if you only speak to the Ministry of Health. We also need to speak to the ministries of finance, and usually in those meetings, there are NGOs and others present who represent the civil society and their concerns. What happens then is, in a first step, the alcohol attributable harm in this country is analyzed by SES, by cause of deaths, by hospitalizations due to alcohol. Then there's an analysis of the situation with respect to financial measures. What is the taxation structure of this country? What other financial means exist? Does this country have a minimum unit price? Does it have a minimum price? The third step is, of course, what is the situation the country is in? How far are the neighboring countries? It's a huge difference, for example, for cross-border trade. If a country is huge, you will not go to the next border if you're in the middle of Siberia. You may go to the next border, or you may consider going to the next border if you are in a small country like Andorra, or in a country like Lithuania, where a lot of people live very close to the border. So this has to be taken into consideration, and the different forms of what Colin called illicit alcohol and what we would call unrecorded alcohol have to be analyzed, and they're completely different in different countries. There are countries who have a lot of home production. There are countries who use a lot of surrogate alcohol, and there are countries where almost all of the unrecorded alcohol is coming via cross-border shopping, which will require different measures. And the fourth step is, what are the revenue expectations of this country? And that's also a very important step. And that's also one of the steps which require the Ministry of Finance to be present at the table. So what happens then? There will be a model to improve the situation. There will be joint working groups between the countries and WHO and academic experts, which will model the specific situation in the country. For example, 5-year predictions based on increases in taxation or increases in minimum price or increases in minimum unit prices or other financial incentives. And we will look into that with and without inflation adjustments, measures to reduce unregulated consumption as based on the specific country. And there would be also measures implemented to better monitor the alcohol trade. So if changes happen in the financial structure of the country, can we pick those changes up very quickly to react to it? Based on those models, some changes will be suggested. And of course, these groups cannot make decisions. All of those models have to be written up in a way to inform the real decision makers, to inform parliaments, to inform the committees of parliament and the experts in the ministries in the parliament. And then, of course, they will have to be revised to fit the specific situation in the country and what the decision makers, the real decision makers, not WHO or academic experts or public health people, wish to do, but what the real decision makers will want to do. Including in that is then a plan to implement and monitor, survey the expected results, and include decision points to evaluate and adapt. All model laws should have those decision points because a lot of those laws are done in very complex situations, and we need evaluations and quick evaluations, not after 4 or 5 years, quick evaluations to actually base decisions on. Each country needs a specific solution, and that is why those country consultations are key. Of course, it is important to have a report on minimum pricing. Of course, it's important to consider all of the options which are on the table. But you have to do that not based on textbooks and knowledge from other countries. You have to do that based on the situation in the country. And that would not only involve country representatives from the government, but also NGOs and civil society. It will lead to situational analysis, to joint working groups and modeling based on the experiences of other countries. And that is where this report on minimum pricing and minimum unit pricing comes in. It allows us to use evidence to model some of those things which have to be modeled based on the evidence so far. And then the best possible solution under the circumstances is going to be selected. And very clearly, not in all situations will those groups come up with a recommendation to implement minimum pricing. I know of a country, for example, where the solution and the suggestions of those groups will likely be to increase taxes. And taxes also have been shown, for example, in Lithuania, to reduce inequality quite drastically. So it depends on the situation. It depends on the harm. It depends on what's already in place in countries and where parliaments would like to go to suggest the best possible solution. And the best possible solution is not necessarily that which academics have modeled to be the optimal, but the best which can be actually brought into parliament. And minimum pricing and minimum unit pricing are part of our tools, are part of our instruments which we can propose to countries to do an optimal mix. And there's a lot to be done. As Franco said, there's almost no markets which are as poorly designed and as inefficient as alcohol markets in today's European region. So there's a lot to do, and this report will help us. I'll finish with this slide about don't be scared, be bold, go smart health taxes. And again, a plea, there will be a new book coming out end of this. And this should be considered as background document. And also the new edition of Alcohol, No Ordinary Commodity will be available to everybody in September. Thanks a lot.
Thank you very much, Jürgen, and also genuinely thank you for drawing attention to these other publications. I think it's important that when we launch these reports that we regard them as part of a continuing discussion. So we're not going to have time to be able to cover everything in the discussion today, but this is really a part of a continuing discussion that we will continue over days and weeks and months and years together. I'll be really grateful to all of you for being part of that. I think one of the things that I heard very strongly from Jürgen, which is really important, is that we should regard not just minimum pricing, but pricing policies as part of a policy compendium to select from for countries' specific circumstances. And later this year, we expect to be adopting the framework for action on alcohol for the WHO European region, which will emphasize that we need to have best buy policies, but we also need to have improved health services, we need to have better labelling, and we need to have communities that are empowered to take action in relation to the policies that affect them. And we need all of it. We don't need just some. We don't need just some of it. We need all of it. So I'm going to pass on now to our great colleague from PAHO, Maristela Monteiro, who's going to tell us about, who's going to respond to the report, but within the context of telling us what's been happening in relation to minimum pricing in the WHO Americas region. Maristela, fantastic you could join us, and looking forward to hearing from you. Thank you.
Thank you very much. Thank you for the invitation. I'm going to share my screen. Hope everybody can see it. And I use the background for the first slide from another presentation in which Franco was part as well. So, so I want to touch upon some issues that were not covered in so much detail, but I think are fundamental to our discussion. One is the big problem that we have, that alcohol is an unhealthy product, unnecessary, is a driver of the NCD epidemic and cause harms to other people as well, and it caused many more harms in other areas, infectious diseases, mental health, etc., injuries. And as a market, it is led basically by transnational corporations with a lot of influence. And these corporations, as you've seen in previous presentations, are not being regulated, very little regulation of the market. And they are together and they are uniting, and this puts a pressure on governments that are unheard of as big, or I would say bigger than for tobacco. And they have one interest, and is to sell alcohol. But just going back here, that interest is inherently in conflict with public health. The more alcohol there is sold, the more harms we'll have. And so there is no possible common goal, I would say, that can be reached with an industry that sells what we want not to sell. So you need to manage that situation, not saying to make it illegal. It is a legal product, but that pressure will always exist. So, so how regulatory policy in taxes and other areas is opposed? They operate with a conjunction of tactics and to protect their commercial interests, to oppose the regulation, to pledge self-regulatory measures, to fund bias studies, to encourage public-private partnerships, defend non-regulatory alternatives. And if they can't stop what governments are set to do, they will try to weaken the policy, raise legal challenges, delay implementation, or simply violate them. And we have seen that practice happening in the area of taxation included. The arguments, as Franco and Angus also mentioned, are very similar between the overall health taxes, and not only for alcohol, for tobacco, they use the same thing, sodas as well, but they are between health taxes and the minimum price and minimum unit price, very similar, about the economic losses, the unrecorded consumption or illicit trade, the problem of WHO or free trade agreements, and that is harming the poor or the moderate drinkers, and countries, in particular in our region, that in Europe, that's what we hear all the time. In Europe, they already have higher taxes and higher prices, and they still have all that consumption. So how do you know it's going to work? And so this webinar for me is very enlightening. And once more, I learned from all of you a little bit, and I'm going to talk about that. So what are the lessons learned? And I would say from this webinar first, being clear and simple is so important. As I heard you all talking, I began to say, is this because I'm listening for so long, or it is this time that it made for me so clear all the steps in terms of taxation, tax share, minimum pricing, minimum unit price. So I think convening these simple messages to the public are fundamental to get their support. Being repetitive as well. So I concluded having these webinars and have fact sheets and have publications and have social media and campaigns, all with the same consistent message will complement and move us to one direction. That's very important. As Jürgen said, and that's what we've been doing in the region, is talking with the Ministry of Finance and health and finance together to understand each other, understand where they're coming from and why, and the benefit of the alcohol taxes. As Jürgen said, that the European region or many countries have a low tax share. Wow, that is even lower than probably in most countries in the Americas. And this is new for me. And I congratulate now that WHO will be following the survey and the methodology that we developed in the region to calculate the tax share, and hopefully we'll have more comparable data across regions as well. And we need to be collaborating, like today, in advocating for health taxes. There's a lot to learn across regions and with the European region in particular. And like Franco said, explaining to the public these big market failures and explaining what is wrong and why the industry needs to be accountable, that sector, and so we can have health. So from the regional work and what has been done in Canada is the only country at this point. First, the alcohol interference should be expected, will continue, but must be minimized. Their lobbying is live and well. There are initiatives now concentrated exclusively on lobbying against taxes and helping citizens to write to their congressman or woman to pledge not to pass a legislation. And just like for any other political issue. And they will continue to go against other initiatives, despite their commitment to support the global plan just approved and the SAFER initiative approved 4 years ago. So we saw in the region that we have provinces that pass minimum pricing, but only one, and Quebec passed minimum unit price, and that was for beer only. We saw from the report that other countries, European countries, are passing on other beverages, so that may be related to what they drink the most, which is wine, I suppose. But also the governments can improve their capacity to counter these strategies by the industry, by regulating it, expanding the people's right to know and corporations' duty to disclose health consequences of corporate practices and products, requiring corporations to pay for health environmental consequences of the products that they sell and produce, protect the science and universities from corporate intrusion, and understand and accept the role of governments to protect public health with what is said the visible hand through regulation. And finally, to prevent corporations and big players to use money and power to manipulate in general democratic processes, because that is what prevents people from getting the knowledge they need, the information they need to support what we want to implement, what countries want to implement, and will make the difference. So thank you very much, and it's been a great.
Maristela, thank you very much, and thank you in particular for reminding us that this is that the global alcohol companies are global, and so we need global and comprehensive responses. So we really need to have these discussions and conversations about how to counter potential interference all the time. In Scotland, where I'm based, it was clear that the minimum unit pricing policy was not implemented precisely because global producers got together to block it for several years, but they did not succeed because public health came together with evidence and we won that battle. And I do believe that we can be optimistic about the future going forward if we are united in terms of basing our policies on evidence and following the guidance that Jürgen and others have given us in relation to assessing need in our different countries, as well as working collaboratively. I want to apologise because there just isn't enough time. There never is enough time to cover everything. I'm really grateful to several of our panelists for their multitasking, which has been quite incredible with the questions and answers. So I see that several of you, so I see Ilana, Nicola and Olita, you asked questions in the question and answer, which I hope have been answered sufficiently for you, but please let's continue the discussion afterwards. What I would like to do though is open up. There were a couple of people who had put questions in the chat, and so I'd like to invite Florence first of all, and then Lena to ask your questions and maybe direct them to whichever panels you would wish to answer. And if we can be as tight in how we phrase our questions and answers, that would be really helpful. Florence Bertoletti from Eurocare. Aram, are we able to?
Hello.
Yes, we have you.
Hi.
I have to say, first of all, fresh from an absolutely fantastic European alcohol policy conference, which we all really enjoyed and learned so much from. So thank you so much for that, Florence. So continuing the discussion.
Thank you so much. I had, and also thank you to the panelists, all of you. It was amazing. I have one question to Colin, and my question is the following: heavy drinkers. You said that heavy drinkers are not the same as dependent drinkers, yet the public, the policymakers, and also the media don't understand this distinction. So should we systematically say what we mean by heavy drinkers? Is there a definition of heavy drinkers? And perhaps should we use a different terminology? Because sometimes that term is not well understood.
Yeah, that's a great question. I suspect we probably, as academics and communicators of science, probably could be a little tighter in our use of terminology and a little clearer, but trying to get global agreement on an appropriate set of terminologies is like trying to herd cats. So I'm not sure I'm going to realistically expect that to happen, but it's important to also recognize that there's a whole group of people for whom this kind of misconception is advantageous, right? The alcohol industry are very interested in keeping this kind of misinterpretation of the situation as it is. And even with all the best will in the world, it's hard to get people to shift their terminology. I mean, you just need to look at the number of newspaper reports that still talk about alcoholics and addicts, for example. So I think we could try harder, but I also think that it's a difficult fight to win.
Thank you, Colin. Maristella?
Just to complement that's what I meant in terms of health literacy and informing broadly other aspects, because it is true that not everyone who drinks a lot becomes dependent on alcohol, but despite that, there are a lot of consequences. But it is in the interest of the industry to put, the heavy drinkers necessarily are dependent on alcohol, and what they need is treatment. So there is a lot to be educating the public to dispel this myth, and the media as well. Thank you.
Thank you, Jürgen. You're muted.
I know. I'm probably a minority in this, but there has been a report commissioned by the Dutch government some years ago to try to find out any differences in the brain functions of heavy drinkers versus the brain functions of people diagnosed with alcohol dependence. Short answer, there were none. Okay. What is alcohol dependence? It's a psychiatric diagnosis for people who are in our healthcare system, and the brain functions after you drink heavily over a long time change, and the brain functions of people who are heavy drinkers over time are not any different from the brain functions of people who are diagnosed as alcohol dependent. It is just a matter of access to the healthcare system, etc. So the basic gist is that what we know is that people will in generally react to price increases, and that includes heavier drinkers, and that includes people with alcohol dependence.
Okay, thank you. Jürgen, can I come back to you on that though? What do you make of the reports from Scotland, though, where there was a recent report with the evaluation of minimum unit pricing, which was suggesting that there was a small number of people who really weren't changing their behaviour, they were just harming their health more with the introduction of the policy?
The different reports from Scotland are showing some kind of differences in the health effects. And there will be a Scottish report which will be summarizing all of those. But what we have learned in a number of instances over the past few years is that we seem to have some groups of people who do not react as expected to overall changes. That means that the total consumption model, meaning that everybody goes down and up in concert, seems to have limits that some of the extreme groups do not come down for whatever reason. Price does not seem to be one of those reasons. You will always have people who will continue despite prices, but overall, what we find is that price increases, no matter how they were caused, will have effects also on heavy drinkers and dependent people, albeit with less elasticities, meaning those people on average reduce their consumption proportionally less than other people, but they still reduce.
Thank you. Franco, did you want to say something on that?
Thank you. Just a very quick comment, because one of the findings of the Public Health Scotland review was that a number of people with alcohol dependence suffered financial strain from having to pay higher prices on alcohol products. Of course, these is not inconceivable. It may have happened. It may happen with taxes as well for a small number of people, but it is not a reason for not implementing taxes or minimum price policies. We cannot throw the baby with the bathwater. Clearly, the benefits of taxes and minimum price policies far outweigh any excessive financial burdens on some consumers, which can be and need to be addressed with other means, not by refraining from implementing these policies.
Yes, so this is again really emphasizing the importance of evaluation, but also of a comprehensive approach to alcohol policies across everything that we need to do. Colin, did you want to say something in relation to this, or should we take Lena so that we have some time? Okay, Lena, you had a specific question in relation to monopolies. So shall I just pose the question, has minimum pricing policies been shown to be effective in countries, jurisdictions that have government-owned alcohol monopolies versus other models of alcohol sales? Colin, would you like to take that one? And then Jürgen.
Yeah, so just to say, I'm not sure about some of the Eastern European countries, but in general, I don't think we have minimum pricing in a lot of places with alcohol monopolies, except for Canada. But the monopoly in and of itself, so if you think of the Scandinavian monopolies, for example, they can kind of introduce almost de facto minimum prices in the sense that they can choose not to stock the very cheapest products. And indeed, that is what happens in some instances. So I think monopolies are kind of a slightly unusual example, because they already have a lot of control over what products are being sold at what prices. So I think there's some interesting and complicated interactions between the two. I guess that's all I want to say.
Thank you. Just to say, Maria has put in the chat that there is a retail monopoly in Belarus, and minimum pricing and pricing measures were shown to be effective there. Jürgen?
In Canada, a lot of provinces still do have monopolies or part monopolies. And it has been shown that minimum pricing has been more stringently carried out in those provinces with monopolies. Monopolies simply allow the state to better control all kinds of regulations, including minimum pricing. And that is what, in a nutshell, the results of the Canadian experiences would show about monopoly and minimum pricing.
Thank you very much. All of this, as I say, is a continuing discussion. I think we only have time for one more question. So Peter Rice, you had a question. Peter, are you there? No, I'll read it out then. So there were strong indications before MUP was introduced in Scotland that big retailers sold alcohol at a loss, but it was impossible to get data on this. Could we hear more about the difference between MUP at wholesale and retail level? So I think that's to you, Colin. Yeah. Colin, can you hear me?
Colin, you have to turn on your...
Yeah, sorry, I'm just, I knew what I was trying to do, I was just failing to do it. So I think there's some, so I guess an interesting aspect of what we've seen in Scotland is the fact that the impact of minimum pricing has been rather different in smaller retailers than it has in big supermarkets. And, you know, there was some concern expressed by some people beforehand that smaller retailers might go out of business as a result of minimum pricing, but actually it turns out that they really like it because it kind of levels the playing field, right? So supermarkets before minimum pricing came in could sell alcohol very cheaply. We don't know, you know, because we don't have access to their internal data, whether they were selling it at a loss or just at a very tiny margin. But there's now, because they can't do that anymore, because the minimum price has sort of brought up the level at which they can sell products, that's kind of leveled the playing field. And so actually it's quite beneficial for small retailers. There's another sort of a separate question about the level at which you introduce a minimum price. So do you introduce a minimum price for retail or a minimum price for wholesale? And I think there's some complexities around that. We do discuss that in the report. I think maybe given the time, it's maybe best that I just suggest people read the report because it's really great rather than go into that at length here.
Thank you very much. I see there was one more question in the questions and answer about why pricing policies have been the least implemented. I have to say that I listened to Maristella's comments about industry opposition to effective policies as being a barrier to them being implemented and needing to have strong political leadership over a consistent period of time to be prepared to take the chance of having an unpopular policy, but also the confidence that it will become a popular policy because it will save lives and make people's lives better down the line. So Juan, I'm sorry, I've run over by about 8 minutes, I think. If I can pass over to my colleague Juan Tello, who is the unit head of the Less Alcohol Unit at WHO headquarters, to thank people and to make some concluding comments. Thank you.
Thank you, Eric, and thank you so much for this enriching webinar. I think I'll share with you my takeaways. And the first thing that I have heard from the different speakers is that minimum pricing, it is effective to reduce the affordability of alcoholic beverage. And I think that is extremely important. And the piece of evidence that today shared with everyone is important to reinforce that message. The second one is that minimum pricing needs to be associated, integrated with taxation. Taxation remains the most cost-effective intervention supported by WHO. So it's this integrated approach that we heard is most successful at country level. What I also think that is extremely important in this discussion is that these two tools of to reduce affordability are linked to the equity agenda and to the behavioral change agenda. So we heard this from Dr. Angus, but also from Professor Sassi. We need to change the mindset around taxation. We need to think how these are tools for improving public health. And I think linking those agenda will make our case stronger to implement. Another very clear message that we heard from different speakers is that reducing affordability will not solve the problems of alcohol consumption. We do need to go to the root cause, and that means reducing affordability, reducing also the availability of alcohol through the different interventions and measures that are well known, increasing the age, reducing the number of outlets or the location of outlets. I think that needs to be recalled as well. And we also need to reduce the acceptability of alcohol. And we heard marketing issues underpinning many of the interventions that the alcohol industry is pushing to get profit and benefits. So I think that that's an important piece of the puzzle that we need to bring together. And we have expressed this as WHO in our safer package. We have proposed countries, best buys and good buys, and we still have a good list of recommended interventions, although the evidence has not been brought yet to light, or not enough to bring us recommended or best buys or cost-effective interventions. And the last point is that I like to take the opportunity to recall all of us that the World Health Assembly a couple of weeks ago approved the global action plan for accelerating or effectively implementing the global strategy for reducing alcohol consumption. And that put us also in a very good position to use this momentum to build better understanding and a community sense to bring back to the agenda of the national agenda the need to tackle alcohol, not because it is only a health issue, it is also a developmental issue. And I'm recalled by the background of Dr. Ferreira that we have a developmental agenda around the SDGs that is very clearly linked to alcohol, to our alcohol agenda as well. So I stop here, I could keep talking, but thank you so much. It has been really a pleasure to be here.
Thank you, and that concludes the meeting. Thank you, everybody.
Aram, should we stop the recording now and